I'm Dr. Greg Naden, and I'm one of the radiation oncologists, and I've been here for 15 years. That is getting to be a more common cancer, and it has to do with, some would even maybe call it an epidemic of virus-caused cancer in the tonsil that is related to HPV. And so we hope that the new vaccine will eliminate this, but still we're seeing a lot of cancer more than in the past of the head and neck. Well, this particular cancer, which is quite common, a lot of times they just notice a mass in their neck. That could be the only thing. It's something that's growing that's maybe a little bit uncomfortable, a sore in the back of their throat or in their tongue. It's not healing, it's difficult to swallow. There's weight loss associated with that. There's a combination of symptoms they can have. Of course, the predominant one is smoking, and that's also often associated with alcohol use. Chewing tobacco, I would say, we often will see now patients who have never touched a cigarette but still get head and neck cancer from this virus. And I say that because maybe at this current time, 30–40% of our patients are that way. What's really good about the virus-induced cancers are they're extremely sensitive to both radiation and chemotherapy. 15–20 years ago, they used to do these very debilitating surgeries where they would take out large parts of the oral cavity or oral pharynx, and now we're able to save all the organs. 15–20 years ago, we would be happy with a 20–30% long-term cure rate. And now we're up at around 85–90%. There has been a small, revolution in the techniques. We're now using chemotherapy, radiation together, and that's been a big step. In radiation, we now have the ability, especially with our new machine, to actually shape the radiation perfectly around the head and neck to treat the target, which can include lymph nodes in the neck, as well as the primary, which is where the cancer started, and spare all these other structures. So the combination has led to more concentrated, precise treatment. It's led to higher cure rates because of higher doses. There's less need for surgery sometimes. The combination, again, has led to these success rates. I would have to say the virus-induced cancers they're often easily cured. So that's helped quite a bit. I think we have a terrific team here. I have a lot of experience in head and neck cancer. We also have, I think, some of the best equipment that you can have. The software is brand new in terms of designing this radiation field. And finally, we have a PET scanner, which I think has really improved the precision and lower side effects as well. It's important to be able to evaluate their prognosis. You have to be honest about that, but I think it's very important to be encouraging, to give the patient some hope, because often we can cure these things. And so I approach it that way. I also try to be available and timely in terms of starting their treatment. It's important that they be seen every week, once or twice. I see my head and neck patients twice a week. You're constantly monitoring what's happening. And then finally, it's very important that we treat the side effects. The nurses are also very experienced. The nursing team is the best nurses I've ever had. They are very in tune with what the patient's feeling and are excellent at paying attention to details, making sure the appointments are set up, that they get started soon, they finish on time. Well, obviously, getting someone cured of cancer with as little side effects as possible. But I think working as a team, which is easy to do here, it's well-staffed, and I think it's such an anxious time for the patient. It can be the worst thing that's ever happened to them. So it's so important that they get their appointments early, that they get seen early, the tests are done without having to wait. And then there's follow-up. We tell them, this is the day you're gonna get planned. This is the day you're gonna get started. We're not gonna wait and let this cancer progress any further than it is. We also, of course, a lot of attention to transportation and getting insurance or other Medicare, Medicaid set up. And then it's an all-inclusive experience. So that would be my message, and eliminate cancer.